Good evening, everyone. I'm Dr. Neha Singh, editor of MahaAP and practicing pediatrician in Navi Mumbai, Raigad. On behalf of Maharashtra Academy of Pediatrics and Women's Committee MahaAP, I welcome all the respected dignitaries, seniors, colleagues, and all the attendees who have joined through our live YouTube channel. First of all, I would like to wish everyone a very happy Gudi Padwa. Friends, today, 2nd of April, is also World Autism Awareness Day, and the theme of the year is inclusion in the workplace. The intention of this occasion is to spread awareness for autism in the society and changing the perspective towards autism. Today's program is for our fellow pediatricians who come across many times autistic kids in their regular vaccination period or any of their OPD visits. The topic for today's program is Let's Chat about MChat. But before we start, I would like to welcome our MahaIP President, Dr. Hemant Gangulia, sir, to give his blessings. Over to you, sir.
Thank you, madam, very much. Good evening and namaste to all the faculties, Dr. Rishikesh, sir, Dr. Neha Singh, Dr. Shilpa, madam, as well as our MahaIP co-chairperson, Dr. Sonali, madam. As well as we have one of the faculty who was in one of the webinar, Dr. Preeti Chaman, madam. All the pediatricians, all the attendees on Maha YouTube link channel. And to start with, wish each one Happy New Year and Happy Gudi Padwa. We come across in our OPD practice autistic children, and many times we are asked to fill the MChat form and then interpret it. Filling the form and interpreting looks very difficult for our general pediatrician at the peripheral settings and the remote places. And our job is to identify them, and proper referral of the autistic children is very important to the appropriate developmental pediatrician. So I have attended 2 or 3 times the things how to feel that, but still the things are not getting easier for us. So we thought, let us make an attempt of making us a role play. Means one of the speaker will be acting as a parent, one of the speaker will be acting as a general pediatrician, and the expert as a developmental pediatrician giving comment on that and how to go about it. And I have attended one ECD, early child who development workshop, which we are going to organize 200 workshops across the country. And in Maharashtra state itself, we are having 40 workshops. And at a Noida Pedicon, when I was called as an observer faculty to attend the ECD workshop, there one of the workstation was filling the MChat form and how to interpret it. And so there also we found at the workstation 15 pediatricians sitting on the table, but then all of the answer and not everyone getting the same score. When the madam asked and we answered, we were not able to get the same score everybody. So this is an attempt to make the things possible, and I think so. We have the wonderful faculty to go about it, and let's hope by the end of the session we will be able to make the use of the MChat forms. Thank you very much, and all the best wishes.
Thank you, sir, for your blessings and support. Now we proceed and start the program. Friends, what is MChat, when, why, and how to use it? It will be cleared by 2 of our experts today. And to make this simpler as well as interesting, we are also going to do role play. We have with us Dr. Shilpa Nambiar. She is a developmental and behavioral pediatrician at present practicing in Panvel, Raigad. Today, she will be playing the role of general pediatrician. And we also have with us Dr. Rishikesh Ghatol. He is also developmental and behavioral pediatrician at present practicing in Amravati. Today, Dr. Rishikesh will be playing the role of an expert, and myself will be playing as a parent. So without wasting any time, I request Dr. Shilpa to please share her slides and start the program. Over to you, Dr. Shilpa.
Yeah. Is my screen visible?
Yes, Shilpa,
Yes.
Your screen is visible.
Good evening, everyone. Thank you, Maha-AP. Thank you, Gangalia sir, for keeping this topic, because screening is the first step for any diagnosis. And as we screen properly, we get a diagnosis, and early intervention can be started appropriately for all the kids who require it. So, as we know, so autism spectrum disorder, it's a group of neurodevelopmental disorder that is characterized by significant impairments in the area of communication, social interaction, and atypical behaviors are seen. So it is 4 times more common in males than the females, and its prevalence is increased according to the latest statistics, CDC 2021, it is 1 in 44 children are suspected to have autism spectrum disorder. So with the increasing prevalence, we have to be more vigilant in our screening. And the best screening method that we have is MChat. So we have to have a better screening, and we should know how to screen the MChat. So as ma'am said, we will be doing a role play. So all children between 18 as the guidelines recommends, 18 months and 24 months, we have to screen all the children by giving the screening test. And autism is known to have regression, and sometimes milder symptoms can be missed in the earlier stage, which can be picked up by 24 months. So it has to be done twice. So let's start with the case. So the first case we will take as an 18-month-old male child who has come for his vaccination visit. So all the developmental screening has to be done in a well-child way. So, ma'am, can we start?
Yes, Shilpa.
Yeah. So, आपका बेटा अच्छे से चल पाता है या पकड़
मेरा यस बेटा मेरा दिन भर इधर उधर मस्ती करता रहता है, कभी इधर कभी उधर, सीढ़ी तो ऊपर नीचे दिन भर करता रहता है, आराम से करता है।
जब भी आप उसको नाम से बुलाते हो तो क्या वो आपकी तरफ देखता है, आता है आपके पास?
कभी कभी देखता है, हर बार नहीं देखता, लेकिन हाँ कभी कभी देखता है।
आप इशारे से कोई चीज क्या वो इशारा करके कोई चीज उसको जो चाहिए रहती है पूछ पाता है आपसे, मांग लेता है कि कैसे मांगता है?
कोई चीज अगर जैसे खाने के लिए या कुछ चाहिए होता है तो किचन में मुझे लेके जाता है, फिंगर से बताता है कि हाँ ये चाहिए वो चाहिए, बाकी बोलता नहीं है।
कितने शब्द बोलता है वो? मम्मा पापा?
ज्यादा कुछ नहीं, हाँ मुझे मम्मा बोलता है, पापा को भी बुलाता है पापा, लेकिन बाकी किसी से नहीं। मम्मी मैं और उसके पापा उससे हिंदी में बात करते हैं इसलिए, लेकिन बाकी उसके दादा दादी वो मराठी में बात करते हैं, उनसे उनका नाम नहीं लेता या कुछ बुलाता नहीं है, सिर्फ मम्मा पापा बोलता है।
So although the questions were little confusing, so we will have to give the screening be given to all the children at 18 months of age. So I request, आप ये फॉर्म है, MChat का फॉर्म है जो हम ऑटिज्म के लिए स्क्रीन करते हैं, ये सिर्फ एक स्क्रीनिंग है, जनरल टाइम नहीं लगेगा, तो ये आपको भरना है। So since we are going to discuss MChat, we will be discussing each question by question.
नहीं मैडम, ये आप क्या बोल रहे हैं? ऑटिज्म में ये कौन सा फॉर्म बनेगा? हम नहीं भरेंगे फॉर्म, ये क्यों भरना है फॉर्म? ये
नहीं सर, दिस इज अ जनरल डेवलपमेंटल असेसमेंट स्क्रीनिंग, सो इट इज नॉट नेसेसरी दैट अगर ये इसमें पॉजिटिव भी आया तो आपके बच्चे को ऑटिज्म है, बट इट इज अ स्पेसिफिकेशन दैट ही कैन बी एक्सपोज्ड टू सम काइंड ऑफ डेवलपमेंटल डिसेबिलिटी, एंड विद आवर फॉलो-अप्स वी कैन सी इफ द चाइल्ड इज हैविंग ऑटिज्म और नॉट.
So one thing which we should always say कि this is a form which we want to get filled because we want to judge your developmental aspects of a child rather than telling autism first. ऐसा मेरे को लगता है. Am I right, Shilpa madam?
Yes, sir, you can put it that way.
Okay.
So it is a 20-question questionnaire which the parent has to fill and bring it back. So we'll go question by question. So the first question in the form is, if you point at something across the room, so does your child look at it? So if you
Madam, this form is available on website. Everybody should download, and if possible, the attendees can download and just have the form in front of their eyes. And just as Madam goes, just screen yourself also how one would, if the answer comes, how one can interpret. So it will be one practical process also. Yes, Dr. Shilpa.
Yeah. So when you ask, if you show something across the room, does he look? So if you point at in the doctor's clinic, अगर आप एक खिलौना दिखाते हैं या बाहर कोई एनिमल एनिमल दिखाते हैं, तो क्या वो उसकी तरफ देखता है?
हाँ, देखता है.
Hello.
Yes, sir.
Yes, Ankere sir.
If you find that the development is normal or within normal range, still we have to fill up this form?
Sir, it is...
Or we have got any doubt then only?
Sir, it is mandatory.
No, sir, it is...
There is no...
Shilpa madam, Rishikesh is responding. Rishikesh expert, please. Mandate.
Just a minute. If find that stranger anxiety is not developed at 6 months of age, child is not crying with strangers, so in that case, but if you find that the development is right from beginning, it is normal, still it is mandatory to fill up the form?
Sir, it is mandatory by American Academy of Pediatrics also to screen each and every child between 18 to 24 months of age for the autism spectrum disorder. And it is one of the best tools that we are available right now is the MChat. So it will be better that for initial informal screening questions, you can also ask also, but it is better if you fill this MChat form.
Right. Then I am just asking just to elevate the this thing, queries in general.
Yes, sir.
Thank you.
Okay, Dr. Shilpa, you can proceed. And now we will go all the questions one by one. And the other questions by the attendees will be taken at the end of the session, or they can send it in the chat box.
Okay. So the first question being, if you point across the room, does your child look at it? It can be a toy, an animal. खिलौना कोई दिखाया या कोई animal दिखाया बाहर रोड पे, तो क्या वो आपकी तरफ दिखता है?
हाँ, देखता है.
Okay. So if the answer is yes, so it can be ticked that as yes. But if the answer is like I don't know, or there is some confusion, you can ask some questions by your side that what does he do typically if you point at something? Does he ignore you? Does he look randomly? Or he's just looking at you or your finger? If the answer is any of these, then you have to mark no. If the answer comes as he looks at the objects or he points to the objects, it means that he knows that you have shown the object and he is pointing. Or he looks and comments on the object. So the answer would be a yes.
Great. So I want to add something. This is a simple question. If you point at something, does your child look at? Actually, होता क्या है कि if we see the child's development, there is a terminology with this personal social milestone domain that a joint attention. So what is joint attention? That if we are pointing towards something, and there are two parts of joint attention also. There is a response to joint attention and initiating the joint attention. And what is the response to joint attention? If I point at something or look at something, okay, then the child should look at the same thing. Okay, either he can point or look at that thing by gazing. Okay, so this joint attention start to develop by 8 to 12 months of age. Okay, so this we called it as a response to joint attention. Okay, and initiating the joint attention is different thing. That is that also comes under the pointing also. So this is first questions is related to joint attention of the child. Okay, and it is nicely elaborated by Dr. Shilpa ma'am. So please continue, ma'am.
So madam, when one say yes, so what score we should write, and when we say no, what score we should write?
So we just tick yes and no at this point of time. We will discuss the scoring when we reach there.
Okay.
So the second question in the form is: have you ever wondered if your child might be deaf? If you are calling him, he's not responding. Does he respond every time? Does he respond when you are called, or he just ignores you, or he does not care?
सुनता है, अक्सर मतलब मैक्सिमम मुझे सुनता है, जब भी मैं पुकारती हूँ ना तो सुनता है मुझे.
So the only two questions that you see is he ignoring the sounds or he is ignoring the peoples completely? So sometimes it happens that वो बोलते हैं कि there is some music which rings and he comes running. So that has to be seen. So if he ignores both sounds and people, the answer is no. If he says yes to either of them, so you have to mark it as yes. During the last part, because there is a reverse of the scoring in this point. So the next question: does your child play pretend play or make believe games? मतलब क्या वो गाड़ी से खेलने के टाइम गाड़ी घुमा के रोड पे से लेके जा रहा है, या फोन पे बात कर रहा है, ऐसे इशारे करता है क्या कभी कभी?
हाँ, करता है. हम लोगों ने उसको एक किचन सेट खरीद के दिया है. वो कभी कभी उस पे खाना बनाना, अपना खाना पीना उसमें करता है, बनाता है, और बाकी अपने टॉयज से भी अच्छे से खेलता है.
Okay. So the child, what he is doing is basically imitating. This is the imitation skill which comes by 1 year to 18 months of age. So you can give various examples in this stage. Is he drinking from a toy cup? Does he pretend to eat by a fork or a spoon? Does he pretend to talk on the phone? Does he feed his toys or stuffed animals with imaginary food? Does he play with his aeroplane going in the sky, flying? So these all questions can be asked to see if he's doing any of it or not. If any one of the answer is yes, then we will tick yes, and if any of it is no, then the answer will be no.
Okay,
all of
great.
it is no.
Okay. So I just want to add something to this question. So these questions related to the play behavior of the child. Okay. Sometimes we can add the play behavior and consider it as a part of the personal social development. If we see and consider the play of the child, the initial during the 1 to 2 years of age, the play is mainly a functional one. That is, the child is playing with the toys, exploring its function. Okay, and after that, there will be a parallel play, and associated with this, there development of this pretend play, symbolic play, and later on, this constructive play also develops. So what happens mainly in autism, the child's play behavior, that the child is playing alone, and the second thing is that it is mainly of a sensory motor kind of thing, that he just exploring and this just touching touching that toys and not playing that toys purposefully or similarly to the other kids of his age group. Okay, so the play behavior is one of the most important thing that we have to consider while evaluating this autistic child. Okay, thank you.
Going to the fourth question is: does your child like climbing on things? क्या उसे ऊपर नीचे करना बहुत अच्छा लगता है? It can be furniture at your house, chair, benches, or in the playground, or during on the stairs. So क्या उसे ऊपर नीचे बार बार करना अच्छा लगता है?
हाँ, बाहर अब तो नहीं, लेकिन घर में सोफा के ऊपर कभी नीचे, कभी टेबल पे चढ़ना करता है वो ऐसे.
So if he enjoys climbing on this, then the answer would be yes. If if she says any of it, no to all, then it is no.
Okay.
Straightforward.
Okay. So I just
If-
want. Okay. So this question is concerned about this motor act that the child likes to climb on the things. Okay. So as we know, the MChat is not only related to autism only. Okay. And if the MChat screening is positive, then it is also indicator of some other neurodevelopmental disorders. Okay. So usually that this autistic kids are hyperactive, or we can call it as a hyperkinetism. Okay. Both the behaviors and the motor ability of the child can be evaluated in this by asking this kind of question, that if the child is not able to climb on the things, that is this milestone usually achieves by around 12 to 15 to 18 months of age, that is climbing on the things. Okay. So if this is not there, this is one of the red flag signs for the motor development, that if the male child, you can screen those child with the with DMD and all other things, because some of these disorders also are associated with the autism. So if your child is not able to climb on the things, this is one of the red flag signs for the motor delay. And second one, if he's climbing on the things and running here and there excessively, then that can be a part of the hyperkinetism that is associated with the autistic behavior. Okay, thank you.
The fifth question comes: does your child make unusual finger movements near his or her eyes? So it can be just wriggling her fingers, flapping the fingers, any kind of movement, just not a purposeful movement of the hands. हाथ हिलाता है, अपने हाथों को देखता रहता है, बार बार हाथों को गोल गोल करता है अपने हाथों के सामने.
नहीं मैडम,
कुछ
ऐसा तो कुछ भी नहीं करता, ऐसा नहीं करता.
एक मिनट. So can I add?
Yeah.
Yes, sir.
Yes. So this is question is this about the finger movement near the eyes. As we know, this autism is concerned with the sensory integration dysfunction. And we have all these senses like hearing, vision, interoception, vestibular, proprioceptive. And when we receive these senses and integrate and behave accordingly, that is the neurotypical behavior. But if we have a deficiency or integration issues, then it can be manifest as a autistic behavior. Okay. This question, which is related to hand flapping and the waving your hands near to the finger, this can be a part of visual seeking behavior. Okay. Or he is having that kind of autistic children are noticed to have that kind of unusual vision, that they look at the toys by unusually, or by one corner of the eyes. Okay. Or hold the toys very close to his eyes, or just do repetitive motor movements like hand flapping, and that will also serve as the stereotypic and the soothing part. Okay. So we can move towards the next question.
मैडम आपका वो स्लाइड में है ना, वो स्लाइड हाइड कर दिया इसलिए वो आ नहीं रहा है स्लाइड शो में.
Okay.
Should I share then?
Sir, yeah, I think I can do.
आपका कोई स्लाइड्स है ना, आपने हाइड किया इसलिए वो नहीं आ रहा है स्लाइड शो में.
Sir, you can share the slides, sir.
I will share, and just little bit another format. ठीक है. कल आपको निकालना पड़ेगा स्लाइड, हाइडिंग का सब निकालना पड़ेगा.
हाँ सर, हो गया.
फुल स्क्रीन करो.
Yeah. So it was explained by Dr. Rishikesh. If there is wiggling or any such movements, it can be sensory or it can indicate, these are basically unpurposive hand movements which are present. So the question number 6, does your child point with one finger to ask for something or to get help? Example, if he needs something, अगर उसको पानी चाहिए या उसको कोई खिलौना चाहिए जो उसके हाथ नहीं पहुंच सकते जहाँ पे ऊपर कहीं रखा है, तो क्या वो इशारे से अपनी उंगली लेके दिखा सकता है क्या उसको जो चाहिए?
हाँ, मैंने बताया ना आपको, उसको जब भी कुछ चाहिए होता है तो किचन में लेके जाता है और फिर बताता है कि हाँ उसको बिस्किट चाहिए, तो उंगली से बताता है कि हाँ मुझे ये चीज चाहिए। मैं समझ जाती हूँ।
Dr. Rishikesh, you want to add?
Yes, as we know, and we have already discussed the initial part, this is the pointing. Okay, so pointing develops at around 12 to 18 months of age, and initially it is a proto-operative pointing, that is a need-based pointing. Okay, and later on, around 15 to 18 months of age, there will be a proto-declarative pointing, that is pointing for sharing the interest part. Okay, so this question is particularly related to proto-operative pointing, that is pointing for getting something. Okay, and not for getting the not for that sharing the interest. Okay, so what happens in autism, the pointing, and these are the also serves as the non-verbal gestures also. So waving bye-bye, response to the joint attention, and this pointing, these are the milestones which are deficit or lacking in the autism. Okay, so we have to consider the pointing, but yes, it can happen sometimes that the mother will say to you that yes, my child points to what he want. Okay, but when we ask them if he also points to share his interest, then the mother say no, doctor, he is not able to point and able to share his interesting things like bug bug bug, I mungi ali mungi. And that I am saying that very small objects also, or the things the child likes to share with his parents. Okay, so this is question is related to proto-operative pointing. But yes, if also the proto-operative pointing is there in the autism, sometimes the proto-operative pointing can be present, but proto-declarative pointing that we are going to discuss with the during the next question, that is mostly deficit in the autism part. Okay, thank you.
So basically in this question, if the mother gives a response that he cannot point, but he can lead you to the objects and reach with his whole hand, that shall also be marked as yes. So any of this, if he leads you to the object, if he can use whole his hand to point for, ask for something, or he can use some kind of words or sounds to ask for the object, will be marked as yes. The 7th question is, does your child point with one finger to show you something interesting? As Dr. Rishikesh has already explained, does he point to an aeroplane going on the sky? Does he point on the road to show you a car or a truck? So does he do that? क्या वो आपको दिखाता है अगर कोई चीज जाती है, अगर कोई कार गई है तो दिखाता है, आपको देख के उसे दिखाता है?
हाँ, उसको बर्ड्स बहुत अच्छे लगते हैं, तो जब भी बालकनी में बर्ड्स या पिजन्स आते हैं ना, वो दौड़ के आता है और मुझे आके दिखाता है।
So if your child is showing any wants you to see something interesting that he has seen, so all any of it can be, if the child is doing it, you mark it as an yes. If the child does not get your attention to show what he is showing, then the answer would be a no. Is your child interested in other children?
1 minute, madam. Rishikesh, what is the difference between question number 6 and question number 7?
It's the pointing part, sir. Hello.
Yes.
Yes, sir. With the question number 6, it is that the child is asking for the his needs thing, that he wants that sugar, or he wants that biscuit. Okay, that there is a need-based communication only, and if you are considering the question number 7, and this is the type of sharing of the things, or he is like to share that interesting that if he is pointing towards the aeroplane flying in the sky, he doesn't want that aeroplane. Okay, that is not his primary need. Okay, or if he pointing towards that small ant or something interesting, that must not be that should not be every time his need, but he likes to share that interest or things with, or likes to show that particular thing by pointing to his parents and get the parents attention towards himself. So question number 6 is mainly a need based pointing, and question number 7 is mainly the pointing for sharing the interest or getting the attention from the parents.
Can we say curiosity? Can we say
Yes,
curiosity?
yes, sir. Curiosity also is one of the part, but this is also lagging in the autism. Okay, because the self-absorbed behavior and deficit in changing the interest from one toy to another toy. Okay, that's why they stick to one particular situation or the toys for the longer time.
The curiosity, I think, can be seen in autistic children also, but they don't have the need to share it with the other. Basically, their social interaction is poor. They're not able to share their interest with the other people. So, like in this flow chart, if you see the last line, so is there, do they show the interest only to express it or not to get help? So, if a child sees an attention, is it because he wants, or he just wants it to be taken away from? See, hello.
Yes, you are audible.
Hello.
Yes, you are audible.
Okay. So moving to the next question, is your child interested in other children? Example, does your child look at other children, smile at them, or go to them?
जब भी मैं उसको पार्क में लेके जाती हूँ तो खेलता तो नहीं है किसी के साथ, लेकिन हाँ अपने बेंच पे बैठ के एक दो बच्चों को वो देख के स्माइल करता है.
So even giving a smile, looking at the children play. So this is what Dr. Rishikesh had told about play, parallel play. Parallel play develop when they are sitting next to each other. They are doing their own thing, but they are acknowledging each other and their play. It does not have to be an associative play or following any rules. So the questions that you can ask is, they say, we don't know. So when you are at the playground or a supermarket, how does he respond? Does he play? Does he talk to the other child? Does he make any vocal noises? Does he watch the other child play? Or act shy at first and then slowly smile? Get excited about meeting or seeing another child. So if any of the above response is a yes, we take it as an yes.
So in autism, there is this autistic children generally does not like to play with the other kids. And another thing is that, as we already discussed, there is a deficit in pointing and the sharing of interest, and similarly, uh, initiating the communication with the other children is the part that most of the children we see this is lacking. Okay, so we can ask some other questions also. If this child is not able to initiate the communication, और घर पे अगर मेहमान आते हैं तो वो जाता है कि नहीं, अभी बाकी भी बच्चे नहीं जाते हैं because of the stranger anxiety that some kind. Okay, sometimes they might be there. Okay, but after sometimes they are habituated to that situation, but autistic children take longer time to start the interaction also, and to habituate with that particular situation or that kind of thing. So आपके अगर घर पे मेहमान आते हैं तो वो जाता है कि नहीं तो बाकी बच्चों के साथ में खेलता है कि नहीं तो उसे कम्युनिकेट इनिशिएशन विद कम्युनिकेशन में उसे प्रॉब्लम जाता है क्या, ये सारी चीजें पूछ सकते हैं. अभी ये हम पूछ रहे हैं कि दिस इंटरेस्टेड इन अदर चिल्ड्रंस और नॉट, दिस कैन बी a part of the anxiety disorder, but as the MChat is only limited from 16 to 18 months to 2.5 years of age, we are not going to discuss it. Otherwise, if the child is of preschool age group or the school age group, excessive, then if that child is not able to initiate the communication or having the extra stranger anxiety, then that can be related to anxiety disorder part. Okay, but that is not related to this kind of case. We will only talk about this autism, and this question is straightforward. And this related to the deficit in interest in the other children or the initiating the communication with the other kids.
The 9th question: does your child show you things by bringing them to you, like showing you a flower? He brings a toy and shares it with you, or he brings his toy, shares it with you. क्या वो आपके पास लाके दिखाता है, कोई चीज उसको मिलती है या कहीं से आया है तो क्या वो दिखाता है आपके पास लाके?
हाँ, अगर कोई नई चीज बनाता है, जैसे ब्लॉक से अगर कोई चीज बनाया या कुछ, तो मुझे दिखाता है लाके.
So basically it can be anything, a picture, a toy, a drawing that he has made, any bug he had found. So if any of the answer is yes, you will be answering yes. Basically, he is showing shared attention. He's looking up, he's bringing this, he's showing his excitement and sharing it with you.
So this is also a milestone of around 12 to 18 months of age. So from 12 to 15 months, sharing and getting the things and sharing with the parent starts. Okay.
10th is, does your child respond when you call his or her name? क्या आप उसको नाम से जब भी बुलाते हो तो क्या वो ऊपर देखता है? क्या वो जो कर रहा है वो रुक के आपकी तरफ देखता है या आता है आपके पास?
हाँ, ज्यादातर वो मुझे देखता है. जब भी मैं उसको पुकारती हूँ उसके नाम से, तो वो मुझे देखता है.
So if the answer would have been I don't know, yeah, confusing, so you can ask the below questions. Does he look up? Does he, when he's talking or whatever he's doing, does he stop doing that? So if he is doing any of this, you can directly take yes. If he fails to do, if he makes no response, if he ignores you, even if you are standing right in front, he's not responding to you, or you have to touch him to get his attention to you. So if he does these, then you have to answer tick mark no.
So this is also one of the features, that inconsistency in response to name call or poor response to name call. So response to name call usually develops by around 6 to 8 months of age. Okay. Before asking or before going to this question, first assure that the child's hearing is within the normal range. Okay. Or the VERA or OAE has been done. Okay, because if the hearing deficit is there, then this response to name call will definitely be a poor or inconsistency you will note down. Okay, thank you.
Rishikesh, a little bit loud, huh? Little bit loud.
Yes, sir. Okay.
So the 11th question is, when you smile at your child, does he smile back at you?
हाँ, जब भी मैं उसको देख के मैं या उसके पापा, हाँ, जब भी मैं या उसके पापा उसको देख के स्माइल देते हैं, तो वो स्माइल करता है हमारी तरफ, दिखता है.
So you have to, there are some questions that you need to ask. Is he smiling when you smile, or he gets excited to see you when you come inside the room? Does he look at you and then smile, or when you are away for some time and when he sees you back, he is excited and he smiles? Or you can ask is your child always smiling? Is he just smiling randomly for nothing? Because So if any of these answers are no or yes, then you have to see which one he does the most. If he's smiling randomly, unknown times, he's just having those bursts of laughter, then you have to give the response no. Dr. Rishikesh, you want to add?
Okay, so ये भी question related है. This question related to the social smile. Okay, so social smile normally develops from around 6 to 8 weeks of age. Okay, and we give when we consider the word the social smile, the word then the phenomenon of reciprocity is equally important. That the child should smile in response to your words, your gestures, or your smile. Even you with even you doesn't speak any words. Okay, if you just smile by looking towards the child, then he should smile. Okay, that is one of the important thing. Okay, so here it is clearly mentioned, if the child is randomly smiling, or he's not reciprocating with your response or the smile, then we will not give that much of importance. And before going to social smile or asking the question, consider that if the child's vision is normal, with vision is within the normal range. Because if the visual deficit is there, then definitely there will be a less visual engagement with the child, less visual engagement with the caregiver, and also the toys, and the fine motor deficit will also be noticed. Okay, so first check the vision, and give the socials, and mark this question as a pass only if the child is giving the adequate response to your words, smiling, or your gesture, and not just only randomly smiling and looking here and there. Okay, thanks.
So the 12th question is, does your child get upset by everyday noises? If does your child scream or cry to noises of the vacuum cleaner? क्या आप मिक्सर चालू करते हैं तो रोने लगता है? कुकर की सीटी जो रोज बजती है, हर बार वो सुन के वो रोने लगता है या चिल्लाने लगता है, कान बंद कर देता है?
नहीं, ऐसा तो कुछ भी नहीं है। कभी भी ऐसा किया नहीं उसने कि वो चिल्लाने लगता है या कुछ। नॉर्मल अपना खेलता रहता है।
So you need to search all the reaction to sounds which you hear every day: traffic noises, a baby crying, or some loud music, telephone, doorbell ringing. So these are the everyday noises which are present, and you need to ask about those. If he is irritated by two or more, then you need to ask how much irritated is he. Does he calmly cover his ears or tell you that he doesn't like this noise, or he is screaming or crying, covering his ears and being upset? So if he is doing those things, he is not liking it, he's crying, screaming, so your answer will be no, will be yes in this case.
Okay, so as we have already discussed, there is a phenomenon of sensory integration dysfunction in autism. So this question is related to the auditory hypersensitivity. Okay, so these autistic children are not able to process the auditory signals those are coming. So that child might be auditory stimuli avoiders, or some child some childs are auditory seeker, that they want to hear the same sound each and every time. Okay, so this is the auditory hypersensitivity phenomena. Previously we have also discussed the visual seeking behavior, and this is the auditory hypersensitivity phenomenon. Okay, so this we need to consider while evaluating the child also. And because of this auditory hypersensitivity or any kind of sensory dysfunction, child may land up into a meltdown phase. Okay, that बहुत बार पेरेंट्स बोलते हैं कि बाकी टेंट्रम तो बाकी बच्चे भी थ्रो करते हैं फ्रॉम 2 to 3 years to up to 5 years of age, बट मेरा बच्चा अगर रोने लगता है, कहाँ पे सुपरमार्केट में गए, नहीं तो कहाँ पे भी गए, और उसने आजू बाजू में बहुत लोग देख लिए, नहीं तो बहुत सारी आवाजें आवाजें सुन ली, तो अगर मेरा बच्चा रोने लगता है तो उसे शांत कराना बहुत मुश्किल होता है. Okay, even if we give him that the particular toy or the chocolate or anything, he will not he will not calm down. This is due to the meltdown and not due to the tantrums. And tantrum gets stopped by giving the things, and meltdown are mainly due to the sensory dysfunction, and auditory hypersensitivity is one of the contributor for that sensory meltdown. So it is equally important question.
Does your child walk? चलता है वो?
हाँ मैम, वो तो इधर उधर कूदता है, चलता है, आराम से चलता है.
This is a very straightforward question to see if the child has attained his motor milestone, if he is having any kind of hypotonia or any issue walking.
Yes, I need to add something. Some of the neurologists are suggesting CPK as a routine part of evaluation for the autistic children. Okay, because they think that the autistic behavior can be associated with the some kind of muscular dystrophies also. Okay, so these are the motor milestone related questions that walking or climbing on the things that we need to ask also. And if there is a delay, apart from the routine investigation that we advise for those autistic children, so also routinely we have to do this CPK testing, particularly considering the male child.
Does your child look at you in the eye when you're talking to him or her, playing with him or dressing him or her? क्या आप उसके साथ जब खेलते हो या बात करते हो, क्या वो आपकी तरफ देखता है? आप उसको चेंज कर रहे हो, कपड़े पहना रहे हो, डायपर चेंज कर रहे हो, क्या वो आपके साथ आपकी तरफ देखता है?
नहीं मैम, यही मैं बात करने वाली थी आपसे कि वो कभी भी बात करो तो देखता नहीं है ध्यान से, कभी कहीं और ही देखते रहता है, दरवाजे की तरफ देखता रहता है या कुछ और ही अपने खिलौने की तरफ देखता है, मुझे नहीं देखता है.
So you can ask certain questions. At what times? Is there any time of the day, like while playing with her, while feeding them, while reading to them? Do they have that interaction, or do they try to give an eye contact with you? So if all the answers are no, you have to mark them as no. If your child look at you at some point of the day, it has to be, is it every day? Or you have to ask this, when you are all together, do they look in the eye at least 5 times at that point? So if he does not, if he is doing it less than that, you have to mark it as a no.
Okay. Yes, ma'am. So this question is related to, as we all know, the social development. If we consider initial part at around 1 to 1.5 months, there will be a face regard, and thereafter the social smile, and around 2 to 3 months there will be a object tracking and good eye contact. Okay. So this question, the previous questions was related to mainly a face regard and the object tracking phenomenon. Okay.
Does your child try to copy what you do? If you're waving bye-bye, if you're clapping, making some funny sound, is he trying to imitate you? Does he try to do that? It can be as simple as आपने जीभ बाहर निकाली या कोई आवाज निकाली तो क्या वो करने की कोशिश करता है? क्या वो आप ताली बजाते हो तो क्या वो करने की कोशिश करता है?
हाँ, जब भी हम लोग क्लैप करते हैं और बोलते हैं क्लैप क्लैप, तो वो क्लैप करता है एंड खुश होता है, बट कुछ बोलता नहीं है, बट हाँ क्लैप करता है. जब भी उसका कुछ फेवरेट कार्टून आता है टीवी पे तो वो खुश होता है तो क्लैप करता है.
नहीं, दिस इज स्पेसिफिकली जब आप करते हो उसके साथ में. सो इज ही ट्राइंग टू डू दैट लुकिंग एट?
हाँ, करता है.
Okay. So this is question related to the imitation part. As the Shilpa madam already told us, the imitation, the simple motor imitation of the facial expression or just sticking out the tongues will develop by around 8 to 12 months. Okay, that there is a part of initiation of the imitation. Okay, and the imitating the other acts, like अगर mother पोछा मार रही है, झाड़ू मार रही है, तो उसको imitate करना. Okay, और other parents के अगर expressions नहीं तो acts को imitate करना, ये fully develop नहीं तो at least most of the parts of the imitation will get developed by around 18 months to 2.5 years of age group.
If you turn your head to look at something, does your child look around to see what you are? अगर आप कुछ देखने के लिए आपकी गर्दन घुमाते हो तो क्या वो भी देखता है कि वो आप किस चीज की तरफ देख रहे हो?
मुझे थोड़ा डिटेल में बताएंगे क्या? जैसे कोई नॉक किया, मैं उधर देखी तो वो देखता है, अब सुनने की वजह से देखता है या मैं देखी तो इसलिए देखता है, इसलिए थोड़ा सा मुझे कंफ्यूजन है, आप मुझे थोड़ा डिटेल में बताएंगे?
It is just that if you are looking at something, so क्या या आपने पॉइंट किया या आप घूमे कहीं देखने के लिए किसी चीज को, अगर वो देखता है तो the answer would be yes. If he ignores you or he just looks at your face, doesn't know what you are wanting to look or show, then it has to be a no.
Yes.
Okay. So this is also a point of response to joint attention. Okay, that we have already discussed, and we are expecting that the child will turn his head to look at the something from around 9 months to around 12 to 15 months of age.
Does your child try to get you to watch him or her? अगर वो कुछ कर रहा है तो वो कोशिश करता है इशारों से, आवाज करके कि वो क्या कर रहा है उसके तरफ. अगर उसने कोई ब्लॉक्स से कुछ बनाया है तो वो ये कर पाता है कि आपका अटेंशन आप उसकी तरफ ले पाता है क्या?
हाँ, वो दिखाता है, अगर कुछ बनाया है या कुछ पेंटिंग किया है तो आवाज निकाल के मुझे बुला के दिखाने की कोशिश करता है.
So basically, if he does that, it's a yes. Or it is not necessary that he has to speak the words look or see here. He can just make any noise or babble to get your attention to what he or she is doing. And he can ask for, keep looking till you praise him. Basically, this is also a part of shared attention.
Okay. And this is the milestone, this milestone, that is getting the parents to watch himself or herself, starts to develop from around 12 to 15 months, and it is mostly develops completely by around at the age of around 2 years, 2.5 years. Okay. So we can expect 18 months to 2 years old child to seek the parents' attention.
18th question, does your child understand when you tell him or her to do something? So when you don't point, you don't have to point, but if you just speak, put the book on the chair, bring me the cup, वहां से मुझे ग्लास लाके दे दो, इशारा नहीं करना है, सिर्फ the words. Does he understand what you are telling him?
हाँ, जैसे घर में अगर मैं कुछ उसको सामान लेके आने के लिए बोलती हूँ किचन में कि अपना प्लेट्स लाके रख दो, तो लाके मुझे देता है, अपना कप प्लेट लाके देता है, बोलने पे करता है.
नहीं, but this is only by himself. सिर्फ बोलने पे अब वो समझता है उस सिचुएशन को and he is getting those things to you, right?
Yeah.
Okay. So if there are no clues in the situation, अगर आपने खाना नहीं लगाया है टेबल पे और सिर्फ आपने उसको बोला थाली लेके आओ, तो he understands that and he brings it.
Yes.
Okay. So this explain. Yes.
Okay, so this is related to the following the commands. Okay, so in autism, this autistic child face 2 or 3 major differences from the other children. The first is that the language deficit and personal social milestone deficit, and third one is the cognitive deficit also. That it is known and is the fact that the 30 to 40% of the autistic children are known to have the cognitive deficit part. Okay, and sometimes some literatures also said that around 50 to 60% of the autistic kids are having the cognitive deficit. Okay, so this question is related to the cognitive deficit. Okay, but there is some controversy with this kind of asking this question. कभी कभार ऑटिज्म वाले बच्चे आपको आपके रिस्पॉन्स टू नेम कॉल नहीं तो आपको परवेसिव इग्नोरेंस करते हैं, आपकी तरफ देखते ही नहीं है, नहीं तो आई कांटेक्ट और अटेंशन ही नहीं दे पाते. सो जो बच्चा अटेंशन ही नहीं दे रहा है सामने वाले व्यक्ति के तरफ, नहीं तो उसके नेम कॉल को, नहीं तो उसके वॉइस को इग्नोर कर रहा है, हाउ कैन ही फॉलोज दैट कमांड? So it is a matter of fact that is it a cognitive deficit or it is also due to a personal social development milestone deficit. But yes, we have to ask this type of questions that following the command that at the 1 year of age group at around 1 year to around 15 years child mostly follows one step command. At around 2 years of age group he follows 2-step command, and around 4 years of age group he used to follow 3-step command. Okay, so complex command following usually start to develop from around 2 years of age group. Okay, so these are the question, and other questions related to the if you want to test the cognitive part of the child, then the other question you can ask apart from this are the object permanence and cause effect relation. Okay, so these are the questions you can ask to test the cognitive part. Okay, later during the preschool age group or in the latter half you can definitely ask about the color, shapes, or counting and different n number of things. But if we consider this initial part of this development, infantile age group and 2 to 3 years of age group, then cause and effect relationship, object permanence, and the following the commands definitely gives you a clue about the cognitive development of the child. Okay, thanks.
So if something new happens, does your child look at your face to see how you feel about it? So if he hears a stage or some noise, or he sees a new toy or someone new, some stranger coming to the house, so does he see how you respond or how you feel about it?
मैंने बोला ना मैडम कि वो मेरी तरफ देखता ही नहीं है, कुछ बोलो तभी भी नहीं देखता है, उधर वॉल की तरफ देखता है, दरवाजे की तरफ देखता है, और कुछ अगर आवाज कुछ ध्यान नहीं देता है, वो अपना ही काम करता रहता है.
So anything unfamiliar or unknown, if it comes and he's not looking at you to see your response to it, so your answer would be a no. No. Yes. Dr. Kish?
Yes, we can proceed forward. We have already discussed this sharing of interest and the during the declarative pointing and all these things.
Does your child like movement activities? Does he like to be swung, bounced on the knee, ऊपर नीचे खेलना?
हाँ मैडम, मैंने बोला ना कि उसको सोफे पे कूदना, इधर भागना, उधर दौड़ना, वो सब करता है, वो बहुत एंजॉय करता है ये सब चीज.
So how does he convey it to you? You can ask is when you bounce, does he like it? How does he react? Is he smiling? He's enjoying it. And when he wants you to, and how does he request you to do it more times? You can ask those specific questions if you don't have a positive response.
Okay, so this question that is related to liking the movement activities, I think it is related to this vestibular seeking behavior. Okay, so until now we have there are 3 questions. Those are related to the sensory phenomenon. One is of visual seeking, One is of auditory hypersensitivity, and this is the third one, that is the liking the vestibular movement activities. This is related to a vestibular seeking behavior. Okay, this is also one of the part of the autism. Yes, and this is a and as such also, this hyperkinetic hyperactivity and hyperkinetism are the part of the autistic behavior. And if the child grows up, then some practitioners also label those child who are having the autistic behavior along with the predominant hyperactivity as the autism spectrum disorder with the ADHD also. Okay.
So we have come to the end of the questionnaire. This is how we have scored. So Dr. Rishikesh, would you like to interpret the scoring?
Yes, ma'am. So there are around 20 questions. There are 20 questions with in this MChat form. Okay. For the answers, if we consider the answers of the question 2, 5, and 12. Okay. So here the answer to the questions, if the answer to the questions of the 2, 5, 12 is S, then it indicates the risk of autism. Okay, and for the other question, if the answers are no, then it will indicate the risk of autism. So for question number 2, 5, 12, if there is the answer is S, then it is indicating the autism risk. And for other question, if the answer is no, it is indicating the autism risk. It is just as simple as possible. Okay, and can we move on to next page, madam?
So
Shilpa
this
ma'am.
is, yeah.
You can elaborate, ma'am, please.
So basically, what we see with the score is, if the score is 0 to 2, it means it indicates low risk for autism. You can see and review only if there are some indicators for regression or delay. If the score is between 3 to 5, basically what you have to do is you have to follow up those questions. This is a form which has to be given to the parent, and the parent does the scoring according to how he feels. When he brings this form back to you, you have to see how much is the score, go back and typically ask the follow-up questions that he has brought as a negative response. So when the negative response is more in between 3 to 8, you have to go back and ask these questions in the format that we have seen, like in the flow chart, specifically with details. If he passes if he gets passed in maximum of it, you have to see if he gets only negative response. If he fails in only 2 of the questions, then you can do a repeat assessment, or you can see which developmental issue does he have. Specifically, if he is not listening, you can ask for a screening hearing screen. If he is not giving a proper eye contact, no smile, those questions are the one which are giving a negative response. You can ask for a vision assessment, but the unpassed part the failed part have to be only 2. If there are more than 2 failed responses, you have to forward them to a developmental pediatrician for further assessment. And if the score is more than 8, you have to immediately refer. There is no need for you to do a follow-up questionnaire with the parent.
Madam, in this case, there are 20 questions, but you have said yes 15, no 4. Yes. Where is one question then?
Sir, the question basically part was basically we have second question, 5th question, and 12th question. Their responses have to be taken as a yes. If that is yes, it is a negative response. That is why the score has come to 5.
Question number 2.
Question number 2. If you have 2, 5, and 12.
2, 5,
and 12. If that comes as a yes, you have to take it as a negative response. and your score will increase according to that. Otherwise, the score is according to how many no's are marked. But in this case, because there was this child who has whose response for the second one is a yes. So that is a predictor of ASD. So, that is a risk factor. So that has to be added in the final score which has been given.
Okay. So, audience, Gangulia sir, it is just simple that अगर क्वेश्चन नंबर 2, 5, 12 हाँ है तो उसको स्कोर में काउंट करो, अगर बाकी क्वेश्चंस के अगर नो है तो उनको सिर्फ काउंट करो, बाकी क्वेश्चंस को भूल जाइए, बस वो सिर्फ काउंट करो और उसका स्कोर लिख दीजिए. और 0 to 2, 3 to 7, 8 and above. 0 to 2 अगर स्कोर है तो रीइवेल्युएट आफ्टर द एज ऑफ 2 years completed. अगर 3 to 7 है तो वो एमचैट फॉलो अप फॉर्म अगर फिर से फिल अप कर दीजिए, एंड वो 8 एंड अबो है तो डायरेक्टली रेफर टू द डेवलपमेंटल पेडियाट्रिशियन फॉर confirmation test, that is the CARS testing.
So
we finish your case 1 or what, Shilpa madam?
Yes, sir. We have finished.
I think so. Dr. Jaya was there from Nagpur. Whether she has left, I don't know. Anyone from audience want to comment on this case 1? If anybody, otherwise we will move to the case 2 then. Anyone
sir, we have one question from Dr. Krunal. How to evaluate a baby having verbal and non-verbal speech delay? So any of you, both the experts can answer.
Okay. So question was how to evaluate the child with verbal and non-verbal speech.
Verbal and non-verbal speech delay.
Okay, this is there will be a long answer for this question definitely. So if any child comes with the complaints of the speech delay, then there can be many a number of differentials for this kind of issues. First look for the hearing part. Second, consider the overall development of the child, that is the gross motor, fine motor, language and social part. And if the child is lacking in all of those domains, and along with that the adaptive skills are also deficit, and if there is a eventful perinatal history that can be or not or may not be there, then it is pointing toward a phenomenon of global developmental delay or intellectual disability. That is one of the reason for the speech delay. Another differential of the speech delay, apart from the hearing deficit or the global developmental delay, is the important part is this autism. Okay, so for autism, we have to there is a phenomenon of developmental dissociation, that is the language and personal social domains are majorly lacking behind the motor domains, and along with that the repetitive behavior and insisting on the sameness, ritualized part of behavior, and the sensory phenomena are mostly there. Okay, so hearing deficit, global developmental delay or intellectual disability, autism are one of the most important differentials for the case of speech delay. And there are other factors also that we have to consider, that if the hearing is normal, other milestones are also normal, and child is interacting with the other kids, okay, and the receptive language is fairly okay, but only the expressive language is lagging, then this can be due to maturational delay or expressive language disorder. Okay, so consider this language disorders also. There are other differentials, that is the childhood apraxia of speech, Okay, that can contribute also. So there are 5 main type of reasons for speech delay: hearing deficit, global developmental delay, a part of autism. It can be a maturational delay, or the language disorder, or childhood apraxia of speech. And consider these non-verbal gestures are very important while evaluating every child with speech delay, because if the non-verbal gestures are deficit, then it can be it will point out us towards the either the ID part or GDD part, global developmental delay part, or the autistic part, because non-verbal gestures are mostly intact, or and the intent of communication is there with the child of hearing deficit, or also the child who is having that maturational delay also mostly try to communicate through his non-verbal gestures. Okay. Shilpa madam, would you like to add something?
Basically, you have to see the receptive language part. If the child is not speaking, if the verbal language is not present, you have to see how well is the child with non-verbal part. If there is an issue with the non-verbal part, you have to investigate more. You have to see why the child is having a global developmental delay.
Okay, thank you both of you. Now can we proceed to the second case?
Yeah. So basically, for this case, we went through all the questions. For the second case, we will not go through all the questions, because when this form is given, this form is given for the parent to be filled. It is given to the parent to fill it and bring it back. You are only supposed to see all the negative scores which the child have given, and follow up with those questions again, so that if you can see if the child is really having that delay, or it can just be you have to ask some questions as we directed. If the small questions, if that is not, it is basically to decrease the chance to see if the child really have an issue or does not have an issue. You have to follow up those questions. So in this case, we will just be doing the follow-up questions. Okay. So the second case is of a 2-year-old girl. So ma'am, can we start?
Yeah,
So
yeah, sure.
when the child came in, she was very shy and not looking. When asked for her name, she did not answer. So जब घर पे आप उसको बुलाते हो तो कैसे रिस्पॉन्स करती है वो? नाम से बुलाने
नाम
पे देखती
पुकारने
है,
से आती है, नाम पुकारने से आती है, देखती है. हाँ.
कितने शब्द बोलती है?
बोलती कुछ भी नहीं है. कुछ नहीं, अभी तक तो कोई शब्द नहीं बोलती है वो.
उसे किसी चीज की जरूरत रहती है, उसको पानी चाहिए या खाना चाहिए, तो वो कैसे मांग के लेती है आपसे? क्या वो इशारा करके मांग पाती है?
नहीं, जब भी कुछ चाहिए होता है तो कभी ऐसा कुछ एक्सप्रेस नहीं करती है. एक जगह दीवार के एक साइड में जाके कभी खड़े होके रोने लगती है जोर जोर से, तो फिर मुझे समझ में आता है कि इसको कुछ खाने के लिए चाहिए या पानी चाहिए.
क्या वो
खुद से नहीं बोलती है.
अगर दूसरे बच्चे रहते हैं या घर पे कोई बच्चा आता है, उनके साथ कैसे बिहेव करती है? उनके साथ मिक्सअप होती है?
नहीं, किसी के साथ मिक्सअप नहीं होती है. वो खुद का ही खेलती है और किसी के साथ किसी की तरफ देखती भी नहीं है, मिक्स होना नहीं चाहती है वो.
So during the examination, if we try to engage her with toys, she is not interested. She is more interested in the buttons of a sweater. So let's see. We'll give the questionnaire to the mother to get filled and come back. So this is the basic form which she has come back. So she has a question mark at question number 2, and so we'll just go through all the no responses. We don't need to responses other than if it is a yes on 2. So we have to ask question. The second one she did not understand, so we have to ask if she is ignoring the sounds or she's completely ignoring the people. as both of them are a yes, she has failed this. So she has the answer is no, and she has.
I think so. We have lost signal. Her signal we have lost.
I think so. We have.
Should I share and Dr. Rishikesh
Yes,
can
sir.
take over?
Yes, sir. You can share. Okay.
No,
she has
back.
come back.
She has come back.
You are on mute, Dr. Shilpa.
Yeah, can you hear me now?
Yeah.
Yes, yes.
Yeah. So the third question, which was answered no. So we ask her all the following questions to see if she is doing any of the pretend play things. She's playing with the cup, or she's using the toy spoon to act as if she's eating. She's feeding the stuffed animal or a toy, real or imaginary food. She's talking on the mobile phone. If all the answers are no, you have to mark it as a failed response. Then the next one was sixth one, which had a no response. So she's not asking with.
Madam, just can you go to back to two slides back? Just I want to ask one query.
Yes,
one
sir.
more back.
Yes.
One more back.
Okay.
हाँ, इसमें खाली नो रेस्पॉन्स को अपन वापस फॉलो अप कर रहे हैं. Am I right? Next slide.
Basically, when
हाँ, इसमें हाँ नहीं ये
Form वाला
इसमें
slide.
सब में जैसे फॉर्म वाला स्लाइड और दिस वन
फॉर्म वाला स्लाइड.
ओके दिस वन
नहीं इसके पहले वाला. हाँ बस. सो इसमें जो नो रेस्पॉन्स है उसको आप फॉलो अप कर रहे हैं, बराबर ना?
यस.
और इधर आपने स्कोर नहीं लिखा है, मगर आप इधर खाली ये 7 लिखा है, नो 11 लिखा है, और अभी अपन नो को फॉलो अप कर रहे हैं, बराबर है ना?
Yes, sir. So basically what is happening is you are giving the form to the parent when the child has come. If the child is between 16 to 30 months, आप उनको वो फॉर्म दे सकते हैं, रिसेप्शन के लेवल पे दे सकते हैं, और from your OPD they are supposed to fill the form and bring it back to you. When they come back to you, you see how many no's are there. If there are more than 2 no's, you need to follow up those questions at that time with the flowchart given, as we discussed in the first case. So you don't need to go and discuss each and every question.
Yes, got it. Yes. Go ahead.
So in this case, all the no responses is what we are going to ask and specifically ask the parent.
Yes. Okay.
So now she is not doing any of the pretend play acts that we have asked. We have made different pretend play activities which she is not. Then proto-operative pointing. For that, you can ask her, is she trying to get the food? Does she lead you to the place where she needs something? So you, as ma'am already said, she just stands at one corner, cries, does not say or does not indicate in any way. So this can be asked as follow-up questions. If the answer is no to all of the above, you have to mark her as fail. Again, the next part. So the same thing. This is proto-declarative, to show something interesting that interests her. Does she point? It can be anything from a regular small insect that she sees at home, or anything from outside that she is seeing. The answer for everything is no. You have to mark her as fail. Then, is she interested in other children? So she is not interested. She likes to play by herself. You can ask some other specific questions like, does she at least look at them? Does she give a smile? If the answer to all of that is no, you have to mark her as a failed response. So in the similar way, all the next question which she had answered no is, does she show anything to bring? Does she bring anything to show you to get your response or to share it with you? So क्या वो कोई पिक्चर दिखाती है जो बनाया है उसने, ड्राइंग बनाया है तो क्या वो लाके दिखाती है? So all the answers are no, she is doing it all by herself. So when called by name, is she responding? So in this case, she responds only if touched. So that has to not be considered as responding, because you're touching her and you're calling her. It can be the touch that is getting her attention towards you. Then in this question, when initially asked that does she look at you in the eye when you are playing with her? So she does. When she needs something, she's giving an eye contact. When you are feeding her, she's giving an eye contact. When you are so there are 2 yes responses on follow-up questions. So that has become a pass for this child. So does she copy to do whatever you do? If you make funny faces, if you stick out your tongue, if you clap in front of her, you can give her different options. If any 2 of the gestures she is doing, it means she can be passed. If she is not doing in only one or none, then it is to be taken as a negative failed response. So does she understand when you are trying to tell her something? So you can ask these follow-up questions to see if you just tell without giving a gesture, because without pointing to what you want to show. So is she doing it? And what happens if does she look at your face when you're doing something? Or so she's not. You can give her those examples. Ask her, does she look at you to see your response? So if she's not doing that, so you have to mark your answer as a failed response. So in this case, as we saw, there was a response which she had marked as no, but it had become pass because she was doing two or three things out of that. So her score had reduced to 10, but still it comes under a high risk for autism follow-up. So she has to be followed up with an specialist. So any more questions?
Dr. Rishikesh,
Yes,
Dr.
sir.
Rishikesh, sir, once again, before going towards the questions, means the first time when we fill the form and see the things and we get the score, so you said ki 2, 5 and
12, sir.
12. These 3 things to be noticed properly. One
Yes, sir.
thing. Anything no to them, na? 2, 5, 12.
Sir, 2, 5, 12, if the answer of any of this question is yes, then you mark the score as you will count that item. And for other question, if the answer is no, then it will be counted as a score.
So suppose there are 4 no's and there are 2 yes for 2 and 5. So 2 and 4 will be 6 will be the score. Am I right?
Yes, sir. Yes, sir.
Okay.
Yes, sir.
And now so once we get the score, then what is what you said 0 to 2 is
0 to 2 no risk. 3 to 3 to 7 intermediate, that we have to follow up with and also ask the detailed explanation of this question with the help of follow-up chart. Okay. Yes, sir.
And when we do this, so
Yes,
what time we have to refer to the developmental pediatrician?
sir, if the on follow-up on follow-up chart, if the score is about 2, then we have to refer to the developmental pediatrician.
So suppose I see the patient today and I ask for follow-up. Follow should be after age of 2 years or 6 months of the first.
Sir, the thing is that if the initial score is 0 to 2, then ask the parents to follow up after the age of 2 years completed. And if the score, suppose the score is 3, okay sir, and suppose the score is 3, then ask the parents the detailed explanation of the questions, or in detail, in-depth explanation. And if after asking that the further information also, and the score, your score is coming out to be or the 2 or above, then better to refer the child to the developmental pediatrician, sir.
So the first time when we want to fill the MChat, the age of the child should be?
Sir, the age was previously they were given that from 16 months to 30 months is the age that we can evaluate the child. But yes, some of the literatures are now considering 18 months to 30 months as the ideal age for screening the child with MChat.
Okay. Now, before going ahead, there are Dr. Sonal is there, Dr. Chitra madam is there, any other audience is there? Any questions? Dr. Wankere sir is, they can just have their questions also.
Dr. Wankre sir has asked one question. Can this chart be re-evaluated when regression of milestones or outgrows these previous milestones in a particular child?
Shilpa madam.
Sir, yes, sir. That is the reason it is told to do at 18 months and again at 24 months, because autism is known for regressions. There are regressions noted in autism. So it has to be done again at 24 months. And if there are any risk factors, or during your developmental surveillance, if you find any of these risk factors, you can do the MChat screening again.
Yes, definitely. And we particularly are talking about the regression in language domain and personal social domain is quite common in autism, and up to 30 to 40% of the children are noted to have that autistic regression phenomenon. Okay, and that is mostly common between the age of 12 to 15 months to 18 to 24 months. And some of the kids I saw in the OPD that the autistic regression is there up to the or regression started after the age of 2 years, and if there is a motor regression also along with the language and social domain, then we have to take the help of pediatric neurologist also. Okay, and consider the other disorder like which also presents with the language regressions and the repeated episodes of seizure.
Okay. Anyone from the audience want to ask any question? Can unmute and ask.
पल्लवी मॅडम सर्वांना परमिशन दिली आहे ना अनम्यूट करायची? पल्लवी मॅडम, Pallavi madam, please give permission to everyone to unmute themselves. If she is there or not.
Done.
Any one of you can unmute yourself and just can ask the questions or any comments you want to give. And if anybody is having the experience of doing this, yes.
Hemant, hello.
Yes, sir.
हेमंत, मला अजून ते स्कोरिंग सिस्टीम समजले नाही, कसे स्कोर करायचं. कॅन यू रिव्हील इट? डॉक्टर ऋषिकेश प्लीज. मला ते समजले नाही अजून.
Yes sir. Sir, total 20 questions आहेत. 20 questions are there. आणि त्यातल्या त्यात आपल्याला दोन क्वेश्चन नंबर 2, 5 आणि 12 जर या क्वेश्चन्स तर आपण त्याला काउंट करू. जर समजा आणि जर बाकीच्या क्वेश्चनचे आन्सर समजा नो असणार तर त्याला काउंट करू. तर समजा आपल्या पूर्ण 20 क्वेश्चन पैकी क्वेश्चन नंबर 2 आणि 5 चा जर आन्सर यस आहे तर मग आपण त्याला 2 म्हणून काउंट करू. म्हणजे 2 आणि म्हणजे त्याचं आन्सर यस आहे तर त्याला 2 स्कोर झाला. आणि बाकीच्या क्वेश्चन पैकी 2, 5, 12 सोडून जर समजा बाकीच्या क्वेश्चन पैकी समजा तिघांचा आन्सर समजा नो आहे तर 3 + 2 तर टोटल स्कोर विल बी 5.
अच्छा, अच्छा ओके.
वानखेडे सर, वानखेडे मी एकदम सिंपल मध्ये परत सांगतो आणि मी सांगितल्यावरती कदाचित ऋषिकेश परत सांगतील बरोबर आहे की नाही. 20 क्वेश्चन आपण विचारतो. 20 क्वेश्चन्स मध्ये फक्त 2, 5, 12 हे क्वेश्चन्स जर येस असतील ते 3 क्वेश्चन पैकी त्याला बाजूला ठेवा जरा. बाकी समजा नो 20 मधून समजा नो आहे, समजा 5 नो आहे, समजा एक्झाम्पल आहे का वानखेडे सर, 5 नो आहेत आणि हे 2, 5, 12 पैकी 2 क्वेश्चनला यस आहे, तर ते 2 आणि 5 असं मिळून स्कोर 7 होतो. समजलं. आणि समजा नो 5च आहे आणि तिन्ही जे क्वेश्चन्स आहेत 2, 5, 12 तिन्ही नो होतात तर स्कोर 5च राहील.
5च राहील. राईट.
समजलं.
येस.
Am I right, ऋषिकेश?
Yes, sir.
Thank you.
Yes.
डॉक्टर चित्रा मॅडम इज देअर, डॉक्टर सोनाली मॅडम इज देअर. सोनाली मॅडम काय बोलायचं तुम्हाला?
No, sir. Session is very excellent. All dynamic. Our young speaker had taken very nice session, sir. I just want to say this only.
Yes.
Okay, I
Yes,
think
sir.
so. No. Yes, sir.
चित्रा मॅडम आहेत का?
Yeah, she is there. Chitra ma'am.
So I think so. Dr. Shilpa madam, just you can without sharing the screen, just read the take-home messages, points, and Rishikesh want to summarize something, and then we will just go ahead with the vote of thanks. आप रीड विदाउट शेयरिंग द रीड करें तो भी चलेगा. शेयर कर रहे हैं, करो.
हाँ sir. So basically our take home is, as it is a high prevalence of development problems in infants and children, you have to have a screening tool. If a developmental problem is found, there may be potential interventions. Intervening earlier in a child development can lead to improved outcomes. So screening involves using a standardized tool can describe a child's risk for developmental delay. And it is the screening is not a diagnostic test. A positive screen identifies a child at a higher risk than one with a negative screen, but does not provide a diagnosis. So further diagnostic evaluation is necessary in these cases. And you can easily download the scoring instructions and the questionnaire from mchatscreen.com. These are freely available, which can be downloaded from there.
Whether they are available in vernacular language?
Yes, it is available in many Indian languages.
Okay. Before Rishikesh give his comments or whatever the expert comments, just I want to ask this MChat we are using to screen the procedure from the age of 18 to 24 months or 30 months. But and then we are referring to the developmental pediatrician for the intervention. Are there any, this is MChat, it's apart, but do we see some features at an age below the 18 months where we really the intervention is required earlier to help the children?
Yes, sir. Routinely Suddha, is it allowed if I speak in Marathi or Hindi?
Yes.
Routinely Suddha, kahi patients, you will get amazed sometimes that some of the parents bring their child that at the age of 3 months, if the eye contact the 3 महिन्याला देत नाही आहे, 5-6 महिन्याला कधी 6 महिना 7-8 महिन्याला येतात की नावाने हाक मारली, नाम से पुकारे तब भी देख नहीं रहा है. नाही तर काही वेळा असं सुद्धा झालंय माझ्यासोबत की फक्त 5 महिन्याचा मुलगा माझ्याकडे आणला होता की जस्ट सर तो एकाकडेच पाहतो, एक वस्तूकडेच असं टक लावून पाहतो. आम्ही जर त्याच्याशी जर इंटरॅक्ट करायचा प्रयत्न केला तर तो आमच्या बोलण्याला रिस्पॉन्सच देत नाही. तर आणि खूप वेळा दुसऱ्या प्रकारचे सुद्धा सिम्पटम्स असतात, जसं आय कॉन्टॅक्ट म्हटलं मी, नॉट इंटरेस्टेड इन अदर ऍक्टिव्हिटीज ऑफ द पेरेंट. तर सुरुवाती जर पासून जर मी कन्सिडर केलं फ्रॉम बर्थ, तर इनिशियल माइलस्टोन्स विथ बी लेस आय कॉन्टॅक्ट ऍट अराउंड 6 weeks to 2 months. दुसरं म्हणजे की आय ट्रॅकिंग आणि ऑब्जेक्ट ट्रॅकिंग नसतं, सोशल स्माइल नसतं, तिसरं म्हणजे आपल्याला की जसं आई वडिलांसोबत जे कम्युनिकेशन रेसिप्रोकेट व्हायला पाहिजे, जसं 5 ते 6 महिन्याली जर बाळ समजा लाईंग डाऊन पोझिशन मध्ये आहे, सुपाईन पोझिशन मध्ये, आणि आई वडिलांनी जस्ट हँड सुद्धा जर समोर नेलेत बाळाला उचलायला, तरी बाळ एक्साइट होतं आणि हातपाय मारायला सुरुवात होतं आणि फेशियल एक्सप्रेशन देतं. ते सुद्धा ऍज अ पार्ट ऑफ सोशल माइलस्टोन आपण कन्सिडर करायला पाहिजे, की ते सुद्धा लॅग आहे का ते पहा. नाहीतर अजून गोष्ट की रिस्पॉन्स टू नेम कॉल सांगितलं, नंतर नॉन व्हर्बल जेस्चर्स जसे आहेत की जर जॉईंट अटेन्शन नाहीये, म्हणजे नावाना हाक मार की आपण मी काहीतरी पॉइंट करतोय किंवा मी एका दिशेने पाहतोय तर बाळ पाहतच नाहीये. आता हे आपल्याला 9 महिने टू 12 टू 15 महिन्याला एक्सपेक्टेड आहे. जर हे नाही आहे किंवा 12 टू 15 महिन्याच्या एज ग्रुप मध्ये आपल्याला तर वेविंग बाय बाय आणि इंटरॅक्टिव्ह प्लेइंग व्हाईल पीकबू हे सुद्धा एक्सपेक्टेड आहे. तर हे सुद्धा नसतं. आणि नंतर 12 टू 18 मंथ्स मध्ये आपल्याला पॉइंटिंग दिसत नाही. सो less social smiling, eye contact, not a reciprocal communication with the adults or the other caregiver, inconsistent call, poor response to joint attention, and decrease or less pointing and less sharing of interest. These are one of the earliest markers of the autism. आणि अजून या व्यतिरिक्त मला अजून एक सांगावंसं वाटतं की कधी कधी पेरेंट्स आपल्याला घेऊन येतात की हा बाळ खूपच रडतो, चालायला लागला 12 महिन्याला, तरी हा खूप रडतोय. आता रडतोय कशामुळे है ना. तर रडणं कधी कधी असतं की children also cry very much, okay, or any other neurological issues ज्यांना असतात, डिस्टोनिया वगैरे, ते सुद्धा खूप रडतात. पण बट सीपी आपल्याला ऑब्विसली आपल्याला दिसून येतं काही डेफिसिट आहे. पण ऑटिझम मध्ये ऍज सच मोठं डेफिसिट आहे दिसून येत नाही. पण हे पोरं खूप वेळा ना खूप इरिटेबल असतात आणि क्रँकी असतात, फसी इटर्स असतात. त्याच्यामुळे हे सगळे पॉइंट्स आपण लक्षात घेतले पाहिजे आणि त्यावरूनच आपण पुढे प्रोसीड केलं पाहिजे. आणि आता रिसेंटली चाइल्ड डेव्हलपमेंटल सेंटर त्रिवेंद्रम यांनी आपल्याकडे भारतामध्ये किंवा ऑल ओव्हर द वर्ल्ड बिलो 18 मंथ्स किंवा बिलो 16 मंथ्स देर वेर नो टूल टू इव्हॅल्युएट दिस काइंड ऑफ चिल्ड्रन. बट आता रिसेंटली सीडीसी त्रिवेंद्रम यांनी फ्रॉम 12 मंथ्स टू 18 मंथ्स ऑफ एज ग्रुप किंवा 2 इयर्स वाल्यांसाठी सुद्धा बाळांसाठी एक नवीन स्क्रीनिंग टूल लॉन्च केला आहे. दिस वॉज जस्ट देअर अचीवमेंट अराउंड 1 to 2 months बॅक. I can share with those tools within the group also, sir.
Okay, sir. Hello.
Yes, sir.
Can I
Yes,
ask one question? Can I ask one question?
Yes, sir.
If a child brought to us with simple language delay, expressive language delay, receptive language is there. There is pointing, mouse pointing is there. Boys of 2 years, but there is no expressive language. Otherwise, child is normal, eye contact is normal, social mixing is normal, social interaction is normal. So in that case, how we should take this case?
Shilpa madam, please.
So a child, if he is not having any expressive he is having an expressive language delay, a hearing test, if it is done, you should always look, because when you see about receptive language, you always use some kind of gestures or actions to indicate something which he is doing. But because as there is no
he responds to call. He responds to call his name.
Okay, but still a hearing assessment, I would ask, has to be done as a baseline, because in case of mild moderate hearing deficits, he will hear a noise, he will hear roughly some kind of this thing in the background to which he is responding. But if he has not attained a proper speech, he has to be looked upon why he is not attained a proper speech at this stage.
Otherwise developmentally normal. Otherwise developmentally normal. Eye contact is there. There is no signs of autism as such, what we have described here. So
Sir,
in that
वानखडे सर, जर असं असणार की 2 वर्षाचा मुलगा आणि बाकी सगळंच नॉर्मल आहे, जर नावाने हाक मारला तर पाहतोय, पॉइंटिंग करतोय, इंटेंट ऑफ कम्युनिकेशन इज देअर, ऑल द थिंग्स आर नॉर्मल, बट अशा वेळेस मग 2च पॉसिबिलिटीज उरतात. आता हिअरिंग टेस्ट केली, बाकी कॉग्निशन सुद्धा नॉर्मल आहे, दॅट इज फॉलोइंग 1 स्टेप कमांड, ऑब्जेक्ट परमनन्स इज देअर, है ना. 2 वर्षाचा मुलगा तर काही आजकाल सिंपल कलर वगैरे सुद्धा ओळखायला लागतो आणि आजूबाजूच्या गोष्टी सुद्धा, तर सगळ्या गोष्टी नॉर्मल आहे, फक्त बोलत नाही आहे. तर अशा वेळेस 2-3 गोष्टी आपल्याला पहिले चेक करा की हिअरिंग, दुसरा म्हणजे ओरोमोटर ॲपर्चर्स वगैरे सुद्धा एक वेळा चेक करून घ्यायचं, आणि तिसरं म्हणजे की आपल्याला एक्सपोजर किती भेटलंय, फॅमिली एन्व्हायरमेंट किती आहे. आजकाल एक फिनॉमिनल आणि कन्सेप्ट आलाय व्हर्च्युअल ऑटिझमचा, की एक्सेस स्क्रीन टाइम अँड लेस सोशल इंटरॅक्शन इज वन ऑफ द कॉन्ट्रीब्युटरी फॅक्टर फॉर द डिलेड लँग्वेज. ओके, तर त्याच्यामुळे लेस इनपुट विल कॉज द लेस वोकॅब्युलरी अँड अल्टिमेटली इट विल लँड अप, द चाइल्ड विल लँड अप इन टू द एक्सप्रेसिव्ह लँग्वेज डिले. तर अशा मुलांसाठी जर बाकी सगळं नॉर्मल आणि फक्त हे आहे, तर अशा वेळेस जर फॅमिली फॅक्टर्स वगैरे काही प्रमाणात रूल आउट करून घ्यायचे, आणि जर मग त्यांना आपण लेबल करू शकतो की बाबा दिस कॅन बी अ पार्ट ऑफ द लँग्वेज डिसऑर्डर, एक्सप्रेसिव्ह लँग्वेज डिसऑर्डर, or it can be a just a maturational delay, and we can.
Right. I think he has lost connection.
Please come back.
Yes.
Unmute करा sir. ऋषिकेश sir unmute करा.
तर अशा केसेसला आपण एक्सप्रेसिव्ह लँग्वेज डिसऑर्डर किंवा मॅच्युरेशनल डिले म्हणू शकतो. आणि पण full and it will be always beneficial one.
So what is the treatment for that then? Should we go for speech therapy?
काहीच ऑटिझम नाही आहे, काहीच नाही आहे, त्याच्यामध्ये सर विल बी डेफिनेटली बेसफुल. आणि अलॉंग विथ दॅट कॅन ऍडव्हान्स ऑल्सो की काही गोष्टी घरी सुद्धा करू शकता. जसं आम्ही म्हणतो की ज्याला ऑब्जेक्ट लेबलिंग म्हणतो, की मला जर सांगायचं आहे, आजकाल कसं आहे की पॅरेंट फक्त विचारतात पोरांना क्वेश्चन आन्सर फॉर्म मध्ये. पॅरेंट्सने विचारलं की हा पहा पेन ना ब्लू कलरचा आहे, पहा पेन, बाबा पेन घेऊन लिहितायत, पेन खाली पडला वाटतं, म्हणजे युझिंग द सेम वर्ड विथ डिफरंट कॉन्टेक्स्ट इट कॅन द चाइल्ड्स वोकॅब्युलरी. आणि या व्यतिरिक्त अजून काही मेथड आहे की पॅरलल टॉकिंग आहे, आपण काय कृती करतो याबद्दल आपण भाष्य करायचं, आणि विथ द हेल्प ऑफ फ्लॅश कार्ड, रीडिंग द स्टोरी बुक्स, आजूबाजूच्या लोकांसोबत आणि जितकं सोशल इंटरॅक्शन बाकी घरातल्या व्यक्तींसोबत सुद्धा वाढवू, तितकं लँग्वेज पोरांची एनरिच व्हायला हेल्प होईल सर.
एक्झॅक्टली. थँक्यू सर, थँक्यू व्हेरी मच.
वानखेडे सर व्हिडिओ चालू करा ना, तुम्ही बंद का करून बसलात? Yes.
Okay, I think so. Any more questions do we have?
Chat box में कोई questions है तो देख लो, नहीं तो फिर.
No, sir. In the chat box there is no question. So I hope after this program, everyone will start using MChat and picking up autistic kids if there are any in their busy OPD. Now for the vote of thanks. First of all, I would like to thank our Maha-IAP President, Dr. Hemant Gangulia sir, and our Secretary General, Dr. Amol Pawar sir, for giving us their support and their platform of Maha-IAP. I would also like to thank our expert, Dr. Rishikesh and Dr. Shilpa, to accept my request for today's program and preparing and doing it so nicely in a very short duration. I would like to thank our Women's Committee Chairperson, Dr. Renu Boralkar ma'am, and Co-Chairperson, Dr. Sonali Shirvate ma'am, as well as other members of Women's Committee for organizing today's program. Then I would like to thank the other pillars of our branch, Dr. Pramod Wankhede sir and Dr. Chitra Kulkarni ma'am. Thank you so much everyone for sparing time from their busy schedule and joining us today, especially on the day of Gudi Padwa. Thank you. And thank you Pallavi ma'am for being always there and solving all the technical issues. Last but not the least, all the attendees on Zoom as well as YouTube channel. Thank you everyone and happy Gudi Padwa to all.
Neha, and once
Happy
again, thanks to Dr. Rishikesh sir to accept the invitation at the 11th hour.
Yes. Sir.
Rishikesh, thank you very much. I think so, yes.
I think
Yes,
so.
yes.
He'll
Rishikesh was excellent, and Neha, you had also was very excellent. Excellent. Vote of thanks also you had given. Very nice.
Sonali madam,